global trial with immunotherapy plus chemotherapy in head and neck and lung cancer. Why I am just trying to tell this upfront is, even if we speak today, out of 100 cancer patients, if 100 has to receive immunotherapy plus chemotherapy, hardly one to two patients will be able to take that because it is too expensive. So we have seen those patients and given to almost 30 patients and closed the trial within this last 1 year. So the reason why I am stating this is, so the Indian patients are hugely benefited with the recent advances in the management of cancer like immunotherapy plus chemotherapy, which is very expensive in the sense that one cycle costs 5 lakhs rupees per cycle. So I'm happy to tell that we have given to 30 patients and closed the trial in both head and neck and lung cancer. So today's topic being breast cancer, we'll just focus on this. So my talk will be on overview of the treatment approach, updates in the diagnostics as well as therapy, and hereditary breast cancer, follow up and what can I do. So these are the numbers as we can see clearly here, which shows the burden of breast cancer in India. So this is the latest data available to us, 2020, in both sexes. If you put across, out of all malignancies, breast contributes around close to 14 to 15% of all the newly detected cancers, followed by head and neck, cervix, lung, colorectal, and other cancers. So this was in females alone. If you look in the terms of number of new cases in 2020, this is the latest data which we have in our hands. So breast cancer in females accounts for around 25% of newly diagnosed malignancies. So breast cancer alone occupies the first place, around 25%. If you have detected 100 newly diagnosed cases, 25 will be breast cancer cases. And in a similar way, the slides are a little blurred, but that's okay, fine. So if you see the burden of the disease in terms of number of new cases, if you put both together as well, also it occupies the number one place. Both males and females, if you put across also, it occupies the number one place, contributing to around 14% of all cases. So this shows the burden and magnitude of breast cancer problem in India. Not just in India, across the globe, burden is huge. Interesting point to note is, if you just look at this plot here, so around the 50s to 80s, the deaths were really high, and after 80s, 90s, deaths started decreasing because of the breast cancer. So why? So this is important because incidence on one hand is increasing because of the increased mammographic screenings and other various factors like environmental factors, lifestyle related factors, etc. So for that, I would like to just give a comment on cancer. Cancer is a lifestyle related disease as well as genetic disease. Similarly, breast cancer as well. So as we know, because of the urbanization and working style and alcoholism, everything put together which comes into lifestyle, smoking. So because of these bad habits or environmental factors and increased detection of the screenings, mammographic screening, the incidence has increased. But at the same time, as we were just talking, deaths or mortality has come down because of the early detection and the better treatment options. Yeah. So most of the times when we see a patient newly diagnosed breast cancer, so the first question what we face as a clinician